Do you have questions about the surgical treatment of breast cancer? These 7 questions that I have compiled in this video are based on robust research to help those who would like more clarity for a decision about what surgical option to choose. It may be for someone who has just been diagnosed with breast cancer, or someone who wishes to support a loved one, or just someone who is curious about breast cancer treatment because you are aware that worldwide, more than 2 million women annually are diagnosed with the condition. If any of these describes you, then this video is for you. We will begin by discovering what experts think about breast cancer surgery. The renowned St. Gallen International Breast Cancer Conference is a gathering of medical professionals. A highlight of every edition of the conference is the consensus statement from a panel of experts who treat breast cancer. These experts declare in their 2025 consensus statement that they aim to provide guidelines for multidisciplinary treatment of patients with early breast cancer, shaped by global perspectives in management and contemporary clinical expertise. We will therefore base these 7 questions on this article, which summarizes the consensus guidelines. Please note that the focus of this channel is on the surgical treatment of breast cancer, so our questions today pertain to breast surgery. On the subject of breast surgery, the panel believes that patients should be advised that breast-conserving surgery, termed BCS for short, and radiation therapy is usually the best treatment option. So, the first question to ask is whether we now know that the experts believe that breast conservation treatment, which is the combination of breast-conserving surgery and radiation therapy, is usually the best treatment option. Since I have just highlighted the experts' panel comments, the answer to this question would be a resounding yes. This naturally brings us to question number 2, which is why the experts consider breast conservation treatment to be the best treatment option. In the consensus guideline article, the experts mentioned that breast conservation treatment confers comparable, if not superior, cancer control compared with mastectomy. So this is the reason why they believe that breast conservation treatment, consisting of breast-conserving surgery with radiation therapy, is usually the best treatment option. This answer naturally segs into the next question, which would be how the experts know that breast conservation treatment confers comparable, if not superior, cancer control compared with mastectomy. A vast body of evidence is available to answer this question, and much of this information is provided in my other videos on breast conservation treatment. In brief, the data shows that breast conservation treatment is either equivalent or superior to mastectomy in terms of survival outcomes or cure rates. In this video, I will provide just 2 articles which have been written on the subject. A meta-analysis is a calculation of data from a combination of studies to assess if the information can be generalized. This recent meta-analysis demonstrated significant benefits of breast-conserving surgery on overall survival at both 5 and 10 years when compared with mastectomy. In a review published this year, these surgeons wrote that recent studies have suggested that overall survival is not compromised, but may in fact be better with breast-conserving surgery compared with mastectomy. This review listed several studies, all of which showed at least equivalent or favorable survival with breast conservation surgery, or BCS for short. None showed better survival with mastectomy. So we have seen a collection of studies which support the fact that breast conservation treatment, or BCT for short, confers comparable, if not superior, cancer control compared with mastectomy. This data provides the evidence supporting the expert opinion that BCT is usually the best option for the surgical therapy of breast cancer. Next, we address the question about other reasons that experts give for recommending BCT. In addition to good cancer control, the experts feel that there is less morbidity, fewer surgical complications, and favorable patient-reported outcomes with BCT. Similar to the research on survival outcomes, there is data to support each of these domains, and the evidence is covered in my other videos, the links for which are provided in the description below. If you wish to know the data in greater detail, kindly click on the links or enter a comment. Thank you. The fifth question we may ask ourselves is, knowing that the experts in the field of breast cancer treatment believe that breast-conserving surgery with radiation therapy is usually the best option for early-stage disease, should a patient with this condition be offered or choose to undergo a mastectomy if she is eligible for BCT? The answer and reason can only be completed individually by each person faced with this question. However, if I were asked this question as a surgeon who treats women with breast cancer and sees the results firsthand, I would always advise a patient to undergo BCT unless there are extenuating circumstances. Question 5 therefore begets question number 6. What are the extenuating circumstances when mastectomy may be the more appropriate choice? We can return to the St. Gallen Consensus Statement to answer this question. The experts believe that if there are one of these three clinical conditions present, recommending mastectomy can be justified. Firstly, if the cancer dimension is large relative to the breast volume despite neoadjuvant systemic therapy. Secondly, if there are extensive microcalcifications or ductal carcinoma in situ associated with the cancer, or if the patient has been diagnosed with inflammatory breast cancer, mastectomy may be more appropriate. These specific issues have been discussed at some length in another video, the link for which is provided in the description if you wish to watch. I also would like to add a fourth condition, that if the patient has had previous radiotherapy or any other medical condition which makes her unsuitable for radiation treatment, she should consider undergoing a mastectomy. Lastly, we ask the question if there is any other reason that a patient with breast cancer may wish to choose mastectomy over breast conservation treatment, which was not explicitly stated by the St. Gallen expert panel. To answer this question, we return to this review written by this team of 4 surgeons. On the issue of local control in patients with the BRCA mutation who have been diagnosed with breast cancer, there is some conflicting data. One study showed that loco-regional recurrence with breast-conserving surgery was higher compared with mastectomy. However, another study conducted at a reputable cancer center did not corroborate this finding. Nevertheless, it was found that the risk of contralateral breast cancer, or cancer in the opposite breast, over 10 years was 14%. Taken together, these authors suggest that women with BRCA mutations who do not wish to follow high-risk surveillance, or if they have concerns regarding risks of loco-regional recurrence or contralateral breast cancer development, bilateral or double mastectomy may be preferable. Being conscious of the caveats that, firstly, for women already diagnosed with breast cancer, there is conflicting data for high-risk gene mutation carriers who are diagnosed with breast cancer regarding loco-regional recurrence, and secondly, that a clear survival advantage has not been demonstrated with bilateral mastectomy. Women with high-risk genetics, like BRCA mutation, may wish to consider bilateral mastectomy. Once again, more information on this subject is provided in my other videos, the links for which can be found in the description below. So in summary, the expert panel gathered at the 2025 edition of the St. Gallen International Breast Cancer Conference agree that 1. Breast conservation treatment is usually the best option for the surgical therapy of early-stage breast cancer. 2. Cancer control with BCT is comparable, if not superior, to mastectomy. 3. There is robust data in support of better survival outcomes or cure rates with BCT. 4th, breast-conserving surgery is associated with less morbidity, fewer surgical complications, and favorable patient outcomes. And 5thly, in my view, women who are eligible should be advised to undergo breast conservation treatment. There are clinical situations when mastectomy may be required. For example, if the tumor is large, there is associated extensive microcalcifications or ductal carcinoma in situ or inflammatory cancer. Bilateral or double mastectomy may be performed for women who have high-risk genetics like BRCA mutation. Thank you for watching until the end. If you have found the information useful, please like, share, comment, and subscribe. You may also visit the Just Medicine website and submit a request for more details regarding the articles I have cited. Until we come together again, take care.